From Rome at ESC 16, a number of publications suggest a more favorable prognosis for women than men undergoing TAVR, despite the fact women experience more vascular complications and bleeding in the perioperative period. So the question is why? Well, let's go to the August 8th issue of JACC Interventions in a paper co-authored by my guest, who is Dr. Marie-Claude Morice, who is the grande of interventional cardiology. That is just one of the great titles of all time. And we're talking about acute and 30-day outcomes in women after TAVR, and this is WIN-TAVI. So the accompanying commentary by Johnston and Christensen described the paper as a groundbreaking attempt to examine the safety and performance of TAVR in women. So first off, congratulations. And a group of female cardiologists really got involved in this. Tell me about WIN-TAVI.
Ah yes, WIN-TAVI was due to the energy of Roxana Meran, Alaide Chieffo, and
It's a lot of energy.
Yeah, it requires a lot of energy because, let's say, despite the major interest on the topic, nobody wanted to support it, and we did it without support.
So what did you find? I mean, this whole issue of is there a difference, there does seem to be an advantage, so can you explain that now?
It's difficult to explain because it's a big registry. We will have many data, 1,000 patients followed during 1 year. We see that what we knew before, that females have an excellent outcome and probably superior, there is more and more evidence that they have a better outcome than male, and with TAVI. So, of course, the question was what to do next. And what we wanted in this registry in particular, go in depth in this population of women, knowing hormonal status, and many things that were never asked in all the trial. And it's of a particular importance because women represent half of the population treated by TAVI, much more than what we see in the usual coronary disease trials.
Now, there were some female-specific factors that you found, and there were the predictors of outcome. I do recall that TAVR device generation and device size were predictors of early outcomes in women, and that suggests, I think, that newer devices with smaller sheaths might be reducing vascular complications. So that you think it gets confirmed by this?
Oh yes, of course. Female have smaller anatomies, smaller femoral arteries. So the improvement that we have nowadays with the new device that have smaller size, will benefit a lot for female because they had more bleeding complication, despite their better final outcome. Yeah.
And what was interesting was even the number of children they've had, the number of pregnancies, made a difference.
Yeah, and this is to be explored because we were also surprised. It has been, we have to understand why. We don't.
So was it more, if you did have more pregnancies, you had lower risk?
No, it was the opposite.
So more pregnancies, higher risk?
Yeah.
So one of the things you mentioned there is the fact that it might be time to include that in the history of the patient when you're considering.
Exactly.
I mean, this is a long time after pregnancies for many of these women, and yet that information might be applicable to what's happening now.
Yeah, absolutely. We will have to follow that on the 1 year outcome, honestly, because we are at 30 days for all patients. But it's important data that have never been studied before.
Wow. So this study, the EC, which I mentioned before, the editorial comment, said this study is an eyebrow raiser and provides incentives for the scientific community to further address sex-specific issues in cardiovascular health. What are you going to do next?
Oh, we would like to have a randomized trial because what is known also is that women in opposite do worse when they have TAVR, surgery for aortic valve replacement. They do worse than men. So if you combine the two, probably females should go to TAVI earlier in their life than men because they benefit more from TAVI than TAVR. So what we would like to randomize is surgery versus TAVI in female with mid-risk in a lower-risk population.
Because we've known that women have more perioperative risk. Have women been turned down for TAVR who probably should have undergone it?
Exactly. That they are going with surgery and where they have a worse outcome. But this needs to be proven in a randomized fashion.
Right. But at this point, there's no reason to tell a woman she can't undergo TAVR just because of the possible risk of perioperative bleeding, if that's the only issue.
No, we have to prove it.
Long term, it looks positive.
Yes, long term is positive. And it's particularly important because you have also not to forget that life expectancy of women is longer than one of men.
Don't rub it in. Don't rub it in.
So it's even more cost effective.
Well, speaking of cost, now that you have some really important data, do you think you're going to get some financial support so you don't have to do this yourself next time?
No, the randomized cannot be done without support. So I hope that that we will convince the industry and other that this is the way they have to go.
Well, I think this is a great paper, and please, if you've got some industry funding, this would be a great paper for you a great trial for you to investigate and invest in. Read JACC Cardiovascular Interventions, the August 8th issue, 2016, and it's the results from the WIN-TAVI, which is Women's International Transcatheter Aortic Valve Implantation, a real-world registry. For CardioSource World News, I'm Executive Editor Rick McGuire.